Mr. Varinder Gambhir, Moderator, Country Director, BBC Media Action. May I request them all? My apologies, Miss Varinder Gambhir.
It's a common mistake, no problem.
It's the same mistake which happens to me also. I am a weak fighter, so not, it's almost always is Mr. Gambhir. A very warm welcome to all of you. So, a very warm welcome to all of you. I now hand it over to Ms. Gambhir to take the session forward. And we also warmly welcome all of our speakers who are joining us online. A quick welcome to Ms. Sara Casillas Ramirez, Forestry Officer, FAO, Ms. Ambika Vishwanath, co-founder, Kubernein Initiative, and Ms. Nidhi Nagabathla, Professor, UN University, Belgium. A very warm welcome to our online speakers as well. And I now hand it over to the session moderator.
Thank you so much. Hello, everybody. I hope, very few people present in the room, unfortunately, but I hope all the people who are present are fully present and looking forward to this concluding session of the conclave. Sorry. I'm Varinder, Miss Varinder, not Mr. Varinder. And I'm from BBC Media Action. We are the international development arm of the BBC, but we're independent of the BBC. We work on behavior change communication for those of you who don't know BBC Media Action. And I think the previous panel, which was very nicely chaired by Mr. Amitabh, and we heard a lot of conversation already around how a lot of work is happening in silos. Sometimes there's climate at one point of time being talked about, somewhere there's water, somewhere there's health being talked about, and we need to build bridges. So I think we've already started from the previous panel starting to talk about building bridges. The next panel now is going to take us through not just frameworks, but how does it look in implementation, how does it look in action really. So we will talk more around how do we build those interdependence. There is interdependence, but how do we make it a reality? How do we ensure that there is more being done? We will dig a little bit deeper into the hows of building that global cooperation. So without further ado, I will first introduce. I think they've already been introduced, but I would just quickly set the context on how each and every panelist is now going to be referring to a different part of the puzzle and trying to solve all of these problems together. So I think when we are talking so much about building cooperation, we all know cooperation requires trust, trust requires transparency, and transparency requires communication. So I think building that lens around how do we bring in more citizen engagement, how do we bring in more information ecosystems into the mix, I think that's where we are going to keep our focus. And I would want to start by asking a common question and try to ask my panelists to just answer the first question within a minute and tell me from where you all sit, what is the single biggest gap in global cooperation for planetary health today? So if we can start with you, Mr. Vinod. If we can keep it under 1 minute. So we'll start with a rapid fire, just so people hear from us. We keep it a little engaging. We'll pull in more people. That's the intention.
Okay. So good afternoon, everyone. Thank you very much for inviting me in this international conference. And special thanks for India Water Foundation for organizing this international conference for transversality and health, energy, and the environment and the water. The main gap, I can say in 1 minute, that how to move from diplomacy of negotiation to diplomacy of delivery. That's the
Perfect. Thank you so much. That's a great start to our panel. We'll move on to you, Mr. Manoj. I'll finish the room here and then move on to the online panelists. What do you think is that single biggest gap that needs to be filled in?
Yes, thank you for actually bringing this question, and I'm thankful to Arvindji for inviting me. The main gap, I think, is when we are talking about the biodiversity, the climate change, and the health. So there is no international framework, a binding framework to actually bring all these three together, because there are so many conventions, there are so many treaties, but then there is no binding framework for all these three to bring together. We always talk that they are interdependent. And though they are interdependent, all these discussions, they are actually made in silos. So, and one more thing is the traditional medicine, the traditional knowledge, both the things, because the traditional knowledge is not necessarily is related to the health and medicine, but also related to the farming and many other things. So there is a lot of knowledge which is not bring together. So this
Right.
total integration is the main thing which I think is lacking.
Yeah, thank you. Thank you so much for that. I'll move us online. Sarah, can we start with you?
Sure, thank you. I hope you can hear me well.
Yes, we can. Can you
perfect.
all hear the room all right? Great, thank you.
Great, thank you. And the previous speaker was an excellent opening to what I wanted to say. I think we do have the frameworks. As was mentioned, we have the biodiversity, the climate, and so on frameworks. I think we need to align. We have so many sectoral policies. We do need to align. We keep developing mechanisms, we keep developing more policies. So maybe it's now time to align those sectoral policies towards a common goal, balancing economic, environmental, and public health goals. So the mechanisms exist, we just need to align them.
Perfect, thank you. I'll move us on to you, Ambika. What do you think is the gap that we need to fill in? We've heard a lot from the other three speakers on, alignment, interdependence, having a binding framework. Yes, what do you think works for you?
Yeah, thank you, Varinder. That's a hard question to answer when there's already been so many great answers. I had to keep crossing out what I was going to say before, but it's a good question, and I will actually say two things, if I might. One is the fact that along with integrating all of these systems that we have is that we need more cross-cutting knowledge. A lot of our knowledge stems from very siloed areas of research and policy making, but very few people actually work in cross sectors. And the other gap I think I see as someone who works on geopolitics and foreign policy is that there is still there's a lack of recognition that a gap exists in many spaces. So
Absolutely.
I think that's something we really need to address.
Yeah, I think at least from the previous session and here, that, on the recognition bit, I think we can say that we are doing a very good tick mark, because everybody seems to be recognizing that we are working in silos. So thanks for saying that, Ambika. Over to you, Nidhi.
Thank you, Chair. So I'll build on the words that are already coming in: integration, alignment, existing frameworks, and I'll also point to the Rio Conventions. I think what we are also missing to do this alignment and integration is an articulated common agenda, which would mean setting priorities out under agreeing to common matrices, accountability mechanisms, monitoring and evaluation. So to speak, an operationalization framework for
Perfect.
integration. Thank you.
Perfect. Thank you so much. Thank you so much. So I think framework is coming as a common thread across what we are hearing. If I may start with you, Ambika, because of your work's focus on international relations, what do you think a truly planetary health approach demand from foreign policy and global governance really looks like? We'll start with you and maybe funnel it down to conversation around other things on the action. So.
Yeah. Thank you, and thank you also to the organizers for having me at this conference. This is my second time, and unfortunately second time online, but I'm glad to be part of this discussion. I'll build on what everybody said and what I have said already, right? It demands a breaking of silos. If we want to reshape how traditional global health and environmental global governance frameworks are fit for the future. They are fit for the 21st century as we are seeing it evolve in the coming years and coming decades. Then it demands a breaking of silos. This breaking of silos, which I know has been spoken about quite a bit, but it's not just at the institutional level, whether we are saying, UN frameworks or a framework within COP or a framework within the UN upcoming UN Water Conference that's going to be held in December later this year, but also in other systems that we are seeing, right? Global governance, global security, human and environment security, unfortunately, is still being discussed in very separate pockets of discussion, right? So if you're talking about hard security, whether you're talking about AI and governance at that level, or you're talking about development security, environment security at the ground level up, these are not conversations that are talking to each other. The reasons for that is that there is a lack of knowledge, as I mentioned, as to how these things actually integrate. So just as we saw the big AI summit that happened in Delhi, there was some discussion on how AI and water integrate, for example, but not a whole lot. For years, we have seen a lot of discussion on looking at energy growth, what is the future of our clean energy growth, but very few discussions in there. Again, I stress on the water because that's something that I work on quite a bit, but also what does that mean for livelihoods, for example. We are seeing an uptick of some of that now, but it's not as much as we need to, because that knowledge that exists when it comes to the integration of how these things intersect, both from a challenge perspective, but also from an opportunity lens perspective, from a business case perspective, is not as much as I would like to see it as, right? So I feel like that's one of the biggest areas that we really need to work on and demand that from our foreign policy and global governance systems. And the last thing I'll say over here is that global governance, we know, and this is a conversation that's happening now every minute of every day, right? Our institutions are failing in many ways. They are not really fit for what we are seeing as, what I would consider a triple crisis of climate change, biodiversity loss, and unchecked development in some ways, right? But there's also a lot of very interesting new forms of governance systems that are coming up, whether they are in multilateral institutions, whether they are in regional governance organizations. And we really need to learn from what that is, what the possibility over there is, and how do we then scale that up, whether we are scaling it up within certain themes or we are scaling it across between countries and between regions, right? So we need to look at these as opportunities to go forward and not just, admire the problem in some ways.
No, absolutely.
So I'll leave it at that and happy to come back to this.
Right. Thanks a lot for that, Ambika. I think which is why we also see that the public health systems are mostly reactive and not really, proactive in their approach. If I can move to you, Dr. Manoj, we've often, seen Ambika also talk about, this public health issue. How do we ensure that these public health systems are more aligned with the environmental and community-based knowledge, and rather than just responding every time there is a crisis? What do you think can be done better to tackle it in a better way?
I would like to mention about one of the main fundamental principle of Ayurveda over here. So Ayurveda talks about Yat Pindetat Brahmande, that is the universe outside is the universe within. So whether it is pollution, whether it is the good health outside, the same is going to be there inside. Now having this considered together, our framework should be in such a way that all the various factors, because the entire universe is made up of 5 elements, the earth, water, fire, and space. So the pollution of all these things, it should be well under control. The quality of all these 5 factors, they should be under well control. And so that whatever is the resource that we use to basically nourish ourselves, and not only the human being, but even the flora and fauna, so that should be good. And once the flora fauna is good, then actually we can be healthy. Now this is the fundamental principle of this. So this principle is again the principle of the concept of the One Health.
Yes.
So if we talk about the One Health, so in One Health, it is not only the human health, it is not only the health of the planet, it is not only the zoonotic diseases. So all the factors, they are taken into consideration together. Now, The conventional method before actually the pandemic, so it was a kind of mechanism that you can say that it was a knee-jerk reaction. Now from knee-jerk reaction, we have to be there in the mitigation phase into the preparedness, and how actually we can be the prepared. So for that purpose, the whole focus should be on the promotion of the health. And when we talk about the promotion of the health, in that the nutrition actually makes the fundamental, principle for the overall nutrition of the overall health. And when we talk about the nutrition, nutrition is not only in terms of the proteins or the carbohydrate or the fibers, but then the concepts like the micronutrients that also should be taken into consideration. The concepts like the flavonoids, the alkaloids and other things which are there in the plants. So they also should be taken into consideration because they are all of very, very important. I would like to give some examples of this, what actually we implemented from the Government of India. And the second thing is of how actually we can switch over from the farm-based practices to the forest-based practices. Now there is a lot of advantage because we say that there are around 3,000 edible plant species in India. Now having considered that we have 3,000 edible plant species, why we are still dependent upon only the farming and only on the cereals and the meat and the dairy products. So nothing but the fourth other than this. Now this practice of dependence on the cereals, the dependence on the meat and dependence on the dairy, so it causes the global warming, it adds to the global warming, the greenhouse gases, the carbon dioxide and many more things. At the same time, the use of the land for preparing or the cultivating the fodder as well. Now if we switch over to the forest, then actually we can use the sustainable use of the forest, we can have the water conservation, the quality of the soil could be good, the carbon footprint, they can be actually, they can be improvised. So there could be actually a lot of benefits of that, and there are some initiatives taken by many governments, including India, the agroforestry policy of the Government of India 2014. So that is the one, the Food Agriculture Organization, they have also taken the initiative. There are around 24 countries across the world, those who have focused on this agroforestry, though actually it is not on a very large scale, but still the initiatives are taken. And the survey of these 24 countries which was conducted, so that showed that there is increase about the 7 to 20% of the micronutrients which is very much required, and there is no requirement of any supplements or the external medicines and other things. So this is a great actually the advantage of this. Now China again is the leader in this. China is again having a lot of use of the forest produce as their food, and there are advantages and disadvantages in the forest produce also, because there could be the regional variation, there could be the climatic variation depending upon the seasonal variation. But these seasonal variations, they are actually incorporated in the traditional medicine. Say for example, in the winter we use the different diet, in the summer we use the different diet. So it is not the same food practices we actually follow. So it varies from season to season, it varies from region to region. So this cultural variation is very important. So this is the concept of biocultural medicine, you can say. The biocultural medicine is how actually we can diversify our nutrition, how actually we can intertwine the health benefits of the food, at the same time the seasonal changes and our culture all together. And when we talk about the health, it is not only the food or only the exercise, but then the culture, the mind-body concept. So all these things come together, and when we talk about the culture, all the festivals, so it is binding the society, it is binding ourselves with the environment, it is creating awareness about the environment and the ecology system. So all these things, they are actually put together in different form of the festivals, say for example Bihu and the Diwali and many more. So these various concepts are there. So I think it is important to actually nurture and cultivate these traditions and integrate into the modern health system, because in the modern health system, the science and the health is on one side and the culture. So there is a huge gap in between. So they should be brought together. So this is very important, and to bring this, I think that right now actually we are implementing only the 3-tier health structure, that is the district hospital, CHC and the PHC. But then from the ministry, we actually propose for the fourth health tier structure, and that is actually to empower the community and ensure their participation in the health.
Right.
Now the participation of those who want to be healthy, so that is the most important thing, and their participation we can actually achieve by providing the capacity building. So create awareness about what is meant by nutrition, create awareness about what is meant by health. So it is not only the medicines, because nowadays people, they actually have developed this concept of going to the doctor for any kind of minor headache, pain, this, that. So many of these actually we can cure, or we can actually come over by utilizing the whatever the resources we have in our kitchen. So this is the fourth tier, and that will actually help in reducing the burden on the government exchequer, the government infrastructure of the public health, and that way actually we can improve the overall health. And this way actually we also can use the resources more available, very readily available, and it can also help to the economy as well.
Great. Thank you so much. Thanks for saying that. I think what you mentioned about the individual well-being and the ecosystem well-being is no more, these are not different things, right? I mean, when we're talking about One Health, for example, we're looking at, zoonotic diseases becoming, very prevalent. And we have to, I think with what you've said about forests, all the, priorities that you said about land governance, with that, I would want to go to Sara. Sara, when we talk about forests and ecosystem, with all of your experience, where do you think, why are we not talking as much and doing so much about environment, ecosystem, forestry, and why is it seen separately from, public health? And what do you think can be done differently?
Thank you. Thank you for that question. And again, thank you for the previous speaker with all that very interesting response to your question, because it really ties into what I'm going to say next. So let me give you a few examples from a report that we did with FAO, the Stockholm Environment Institute, Conservation International, and the Nature Conservancy at the end of last year, linking forests to agriculture. And I'll get to the health in a second, because it's all linked and we don't necessarily recognize all these linkages. So we have global evidence that agricultural areas in 155 countries rely on forests in other countries for up to 40% of their annual rainfall. So this is rain-fed agriculture, and this really underscores the transboundary nature of forest, climate, and agricultural interactions. When we look, for example, at the regional level, the Congo rainforest recycles over 40% of the moisture at the local level, and then it contributes more than 10% of the rainfall that goes to other distant agricultural areas in Africa. So whatever I'm doing at my local level, all the biodiversity, the water services, everything that these forests are providing are really impacting people elsewhere. So now let's talk about deforestation and forest degradation. So deforestation has been shown to have very negative impacts on rainfall, but it also has a human cost. And this always remains seen, or it remains in the public health domain, not just the forestry domain. So between 2001 and 2020, studies have shown that tropical deforestation is likely to have contributed to about 28,000 additional heat-related deaths annually. 28,000 additional deaths annually because of deforestation. And this suggests that forest loss is not just an environmental issue, but also a public health issue that we need to address. So when there is deforestation, we see increases in temperature, and this impacts the health, mortality in this case, but also productivity of rural workers. So the reliability of our global food baskets on forests or rainfall means that they are very vulnerable to deforestation, posing threats to food, water security, biodiversity, and this is ultimately public health and planetary health. So when we talk about governance issues, it is really vital to link forest governance, not just to the environmental services, but really to the health impacts that this can have. Understanding that good or bad forest governance and management can have significant impacts well beyond the area where this is happening. This goes beyond the forestry sector. There is this initiative linking on water governance and governance of the global water cycle, linking whatever is happening at the local level to the global level. And so we need this policy frameworks. We really need to align everything so that we understand and keep these linkages. At the end of the day, it really is about One Health, understanding that ecosystem health is directly related to human health. So yes, I leave it there, and I think in terms of what we can do, align.
Yeah. No, thanks a lot. Thanks for saying that, Sarah. And as development communication practitioner, I think it's also about how we sometimes communicate this crisis, which is why I think the institutions are not able to, look at this as an interconnected problem. So I think it's also building those interconnected narratives around the interconnected risks that we face. But thanks for that, Sarah. I would now want to move to you, Mr. Vinod, on, in your experience, what are some of the structural reforms that can be done to bring, all of this commitment more into implementation? What do you think can be done?
Can I use that?
Yes, please.
So thank you very much for this question. I mentioned in the beginning that important thing is how to move from diplomacy of negotiation to diplomacy of delivery. Delivery, it's important. So I'm mentioning 4 things. Number 1 is shaping governance. How can we shape the governance? That's the first thing for the implementation and the actually delivery. I will give an example how India can lead Global South. It's a big opportunity for India to lead Global South on the planetary health diplomacy. Number 1 is we have established the digital public infrastructure as a model. And I can mention the example of the Ayushman Bharat that already Government of India has implemented, and around 38 crore, 380 million people are getting benefits from the Ayushman Bharat. And this is the very big a kind of example that Global South can learn from India. And it's a big thing for implementation, the health, support and benefits at a grassroots level. Second is that Mr. Manoj has mentioned the traditional medicine. And in Jamnagar, I remember WHO, the sister UN organization, they have established the traditional medicine center in December 2025, very, very soon. 25, also 22. 2022, okay. So now they are trying to create a new wellness center established on the yoga, naturopathy, and different. I'm not from the allopathic medicine, but the traditional medicine, shifting the whole focus. So that is WHO has opened the new center in Geneva, especially based on the Ayurveda and the yoga for the wellness. And the,
All traditional systems of medicine across the world.
across the world, but they have opened the special center for only for the yoga and Ayurveda and naturopathy. So this can be help to implementation of planetary health diplomacy very well, and Global South can learn from this one. Second thing is multilateral system. We will have to improve the multilateral system, and again I will give the 2 examples from India. One is the CDRI, Coalition of Disaster Resilient Infrastructure. It's established in India by the Government of India, and they are working globally for the early warning and resilience and providing support to disaster management. And disaster is the biggest killer. It's the biggest challenge for the health. So CDRI is one multilateral example. Second also, the International Solar Alliance, this is also based in India, and it has a direct connection between the energy and the health. So how can we improve the multilateral system to improve the health at health diplomacy and the planet? And third is more about the warning system. How can we create early warning system across the world? Around 60% countries, they have already established the multi-hazard early warning systems, but still there is a need of more to do, because early warning system is important in terms of the flood, in terms of the heavy rain, in terms of the disaster, because these are the areas, the natural disaster, that is the challenge for the health. So this is also early warning system is a key from the implementation of this planet diplomacy. And the last I can say, because I'm working for the UNOPS. So under UNOPS, I mean, the fund is not only enough to construct a hospital or health center. Important is to how can you make a resilient system in the health, and the green procurement is the important. Now entire world is moving towards normal procurement to the green procurement. So green procurement system we have UNOPS has adopted, and we are trying to embedding the carbon footprint, reducing gender equality, and preparing infrastructure who can be disaster resilient, and they can work for the nature same way. If you see the loss of and the damage, around $4.5 trillion. I mean, every year we are losing, and then the health also. So for implementation, I can say that the goal established by the Government of India for the Viksit Bharat 2047 and net zero by 2070. That is the biggest goal established by the Government of India for the whole world in terms of the planetary health diplomacy. And in that term, I can say for the implementation, many things the Global South can learn from India, and India can learn from the Global South, and that can be very, very useful for the implementation. So thank you.
Thank you. This is working. Thank you so much for that. And I think moving from the strategy like you're talking about, I think how do we bring it down to action? How do we bring it down to more citizen action? I think there's a lot of work on that also that has to be done, right? And where does, again, communication, data, science, where does that play a role? So I'll quickly just move on to you. Nidhi, are you there with us? I think your connection has been giving some troubles there. So,
can you hear me?
yeah, Nidhi, usually we have data, we have science, but we're not able to, quickly do any real-time action. What do you think can be done to, understand that we are doing evidence-based action and, doing it in real time? What do you think can be done? And I think I've been told that we are, we don't have too much time. So after we hear from Nidhi, maybe we'll just go around the room. You all can give closing remarks and, whatever it is that you really want to, talk about can be done in the next 3 years, and we'll stop at that. So over to you, Nidhi, to answer this.
Thank you again for asking this relevant question. So I'll say that globally, as a global community, member states of the UN, also representing a UN agency here, there is no shortage of science and institutions. I think where we have to put effort is building a unified, acceptable agenda, like we have also done for other causes, for a planetary health compact or an alliance that can be integrated into existing frameworks. That could be one easy modality to get it going. One Health is also emerging as that framework that we can embark on. If there is acknowledgement of One Health agenda across member states and between member states to set a regional agenda or national agenda or a global global kind of, again, I said, matrices and monitoring frameworks on how to collect or aggregate existing data to operationalize this. I think we are quite fine with the data that some of the countries are already collecting, but we need to understand the matrix that this framework represents a planetary health alliance or planetary health objectives. One thing I also want to kind of allude to again is maybe to create again, to take a reference of science policy SPIs that we call in our work, SPI science policy interface frameworks. If one key example which we already all know is IPCC, is the SPI for climate, IPBS for ecosystems, and I think for health we have an agency, UN dedicated agency, WHO. But if other this could become an interagency agenda, then I think there is a bit of a trigger to dedicate pledges, financial resources, technical capacity. One of the things we also noted while working in different regions, and I'm talking about Central Asia here, is that in the health community there is no clear understanding of what is planetary health. So we have just signed a MOU with a semi-medical university in Kazakhstan to train the medical health professionals from Central Asian region to understand, to unpack what is planetary health. Because I think they see their agenda to give more of a medical advice or do treatment. And one thing which is completely missing from this discourse on planetary health integration is focus on mental health and psychosocial well-being alongside physical health. So these are the gaps and needs that we are monitoring, where to leverage existing data, information and knowledge, where to fill gaps, and how to dedicate technical capacity, financial capacity, pledges and commitments to fill those gaps. One good example is a WHO led agenda, or in the climate discourse, they have brought to the table, high level table at COP, climate COP, community of practice and coalition of parties, on climate health nexus. So each of the UN activities programmatic agenda should have an objective on understanding, researching, coming out with evidence on climate health nexus. And I think these are small steps that will go a long way in helping to mainstream this at multiple levels. Maybe I should maybe also close with focus on other things that we see are relatively under-reflected, which is the process of co-creation. So most of these agendas are set at a very high level. We need to bring it to the community level, not as something that they have to implement, but something they can co-create. And that's where our co-panelists also brought the traditional ILK, the indigenous and local knowledge. These are again elements or dimensions not really clearly reflected. They are being talked about, but having a meaningful reflection or integration is a totally different game. So I think we have to go from talk to action and integration.
Thanks
I
for
think
saying
these
that.
are a
Sorry,
few points that I maybe pause at. I'm happy to expand on any.
Thank you so much. Thanks for bringing in mental health, working with the communities, looking at local solutions. I think these are very, very important points that you mentioned, Nidhi. With that, I'll move on to Dr. Manoj now. If you can tell us, also your closing remarks really, if you can tell us, if in the next 3 years, there was this one thing that could be done to bring, we've spoken about a lot of, building interdependencies, not just looking at agreements, but also looking at information flows which are better. There's better collaboration between global south and north, even between communities. Yeah, so I think it'll be great to now hear from all the panelists. Again, if possible, under a minute, because I have been shown the clock many times now. What do you think? And if you want to add anything else in your closing remarks as well.
सबसे पहले मैं सीनियर नेता श्री राकेश जैन जी का स्वागत करता हूँ, आज हमारे बीच में है यहाँ पे. So coming back to the question, the main important thing what I think to be done for the next 3 years is to develop the collaborations. And the collaboration, what I mean to say, that the collaboration between the various agencies, the academia, the industry, as well as the government, so all they should come together. What the Prime Minister says, that the one government or this government approach, so that approach should be adopted. From the Ministry of Ayush, we established collaborations with 18 different ministries and departments of the Government of India. And there are many success stories to tell about that. The first important thing is for the first time, the ICAR, the Indian Council for Agriculture Research, the Ayush, the Ministry of Animal Husbandry, and the CDRI. So we all come together, and with this actually, there is a lot of possibility to do the lot of new research. For example, during the COVID pandemic, the Ministry of Ayush promoted the concept of improving the general immunity to protect the people from the COVID. And this concept, it actually helped quite significantly. There are a lot of research, lot of data has been generated on that. Now, similar concept can be implemented on the agriculture side also, so that we can improve the plant immunity, so that there can be the minimal use of the pesticides, and that way actually we can curtail the use of the pesticides. So that could be the one approach we can take. There should be the collaboration, and we can actually exchange the information and our experiences with the various departments and the various countries. Say for example, under the BIMSTEC, we have established the BTFTM, that is the BIMSTEC Forum for the Traditional Medicine. And under this BIMSTEC forum, we are sharing the various experiences that we have, how the India integrated the traditional medicine, it promoted the traditional medicine in various aspects, whether it is related to controlling the infectious diseases, whether it is related to curtailing the NPCDCS, that is the prevention and control of non-communicable diseases, whether it is related to the substance abuse and the drug addiction. The one participant, she mentioned about the mental health. So that is also very important. And this information we shared with the USA, because the USA, UK, England, now they are actually suffering with the lot of the mental health issues. There are the Ministry of loneliness. So these kind of issues are there. So actually sharing this information, you mentioned about the GTCM. So the Government of India, Minister of Ayush supported wholeheartedly to the WHO to establish the GTCM, so that the Global Traditional Center, it has been now established in India. And because of that, all the different traditional systems of medicine across the world, now they can be showcased in India. They can, the people, they can come together. And at the same time, we have started doing an exercise. What are the different similarities between the traditional medicine? If I want to share with you that Ayurveda probably is the mother, like we say that the Sanskrit is the mother for all the languages. So likewise, Ayurveda is the mother for all the traditional medicines, and the different traditional systems of medicine. They are the outcome of the yoga and the Ayurveda. So this is there. As I mentioned about the fourth tier of the health structure, so that actually we can promote. We are sharing this knowledge with the Brazil, because Brazil also has this huge biodiversity and the similar issues related to India. Two quick examples of the benefits I would like to mention. One is the grape-based formulation for preventing or the controlling the iron deficiency anemia, because for last 70 years the Government of India has been actually pumping the folic acid and the iron, but with that there was no any curtailment. Even today, around 30 to 40% of the population in India, so they are having still iron deficiency anemia. When we provided this grape-based formulation to the children in the certain pockets, and we found that within 1 year, the incidence of iron deficiency anemia, it dropped down significantly from 39% to 2.1%. And then there was a lot of research, and after this research, the Prime Minister now he has promoted this this formulation under the mission Utkarsh, and under the mission Utkarsh now it is being widely practiced. The second is related to the implementation of the antenatal care, which is provided by the Ministry of Ayush through the Ayurveda, and in that the overall weight of the babies, so that increased from 1 to 1.5 kg to 2.5 kg at the time of birth, and the time taken by a primate to deliver a baby, usually it is 24 hours to 48 hours, it dropped down to 6 hours. So with this significant, there is we can say that there could be reduction under the in the MMR and the IMR. So there could be so many these initiatives that we can take, and we can achieve the overall well-being of the Paryavaran as well as the human being. Thank you.
Thank you so much for this. And like I was saying, I've been shown the clock several times. But thank you so much for everyone to join. If there is any burning comment that anybody wants to make, I would still keep the window open for just 30 seconds. Is there anything from our online panelists? Otherwise, Nidhi, I think you did talk about your closing remarks. Anything from you, Ambika or Sarah? Otherwise, we will just close because
Maybe I think I can make a quick comment, maybe 30 seconds.
Under
So I
30
think,
seconds, please. Yes, go ahead.
from an international perspective, more priority space in that agenda. And I think that's where I want to also focus on pooling resources and authority. So it has to be transversal around different sectors. Health is not just health ministry. It has to be a joint shared goal across sectors and agencies.
Absolutely. I think if there's been one key takeout from this as well as the previous panel, Nidhi, that's been exactly this, right? That it's not one ministry, it's not, one institution that's working on this, it's all of us coming together. I think if I was to take a show of hands in this room and ask how many people are working on climate and health, I don't think we'll find too many as well, right? So I think it is important. Okay. And then we'll just close.
TPC, Triple Planetary Crisis.
Uh-huh.
So this is the very, very important for this planet health diplomacy.
Right.
So, I mean, if you want a good implementation, we will have to focus on the TPC.
Absolutely. Thank you so much. I mean, I did have a lot of other questions, as you all know, but I think we'll stop here today. But carrying on the discussion separately, it was really, really interesting. Thank you. Thank you to all the panelists. I'll stop.
Thank you.
Yeah, thank you.
Thank you for a wonderful discussion, and thank you for making it very inclusive for everybody. We thank our online speakers as well for their contributions. And to present a memento as a token of our appreciation and thanks, may I request Dr. Arvind Kumar to please join us on stage. We start by thanking our esteemed panelists, Mr. Vinod Mishra, Country Director, UNOPS. We thank Dr. Manoj Nesari, Advisor, Ministry of Ayush, Government of India. And our very sincere and heartfelt thanks to the esteemed moderator, Ms. Varinder Gambhir, Country Director, BBC Media Action. Request you all to please join us together, everybody front and center, for a group photo op. I request the stage team to please set the stage for the next session. This next session is a leadership dialogue as well as the valedictory.